We're honoured today to have Dr. Sandra Nagl with us today around the topic of ergonomics in endoscopy. One of the factors that we often hear in the conversations that we're having is that it's a very female-centric kind of issue. We're trying to take that away from becoming a female. I think it's a wider endoscopy community side of things. I think it affects males and females. What are your thoughts on that?
Well, I think it's a topic which affects everyone, irrespective of the gender. Yeah, we have different body size, we have different hand sizes, we have different strengths among females, among males, so it's affecting everyone. I think we should early on treat ergonomics or integrate it into our routine, not only when we already feel pain, but because then we are not preventing it, we are just reacting, and that's too late.
If we're talking from a personal level, what made you focus on ergonomics in the endoscopy suite and become such an advocate for ergonomics?
I think the first thing is when you got into the topic is when it's actually affecting yourself, when you suddenly feel pain after long-lasting procedures, and then you think, okay, what can I change, what can I adjust? And interestingly, when I started to think about how can I adjust my monitor, how can I adjust my processor, then I felt when you have an ergonomic ideal posture and room setup, it actually also contributes to a better maneuverability of your scope, a better control of your scope. So this goes hand in hand, and that's very interesting. So you're also improving your technical skills by paying attention to the ergonomics.
So I think that comment is probably very useful for trainees, right? So ensuring that they have an ergonomic feel of their room would contribute to a better procedure, and therefore a lot more comfortable in patient outcomes.
Definitely, and that's so important that we start early on in your training and that we combine these two, technical skill acquisition, but also ergonomics at the same time. And then I think what can really help early on is maybe just to film yourself and see how you perform your posture during your endoscopy, just to give you some feedback. Sometimes we see endoscopists moving around, we get to reach somewhere and they are scoping with the whole body instead of just scoping with the scope. I think this could be a really good feedback, and having just a checklist where you can just cross-check, okay, I did this, can really be helpful.
What more can industry do to support the endoscopic room design? So you have lots of different pieces of equipment in the endoscopy room from various different manufacturers. How can they all work together in order to give you an easy-to-use atmosphere or environment?
Well, we see quite a progress in the last years in terms of that, but still we have the fact that most of the endoscopists, despite advancements in other areas, still have mostly the one-size-fits-all approach. And I think this is something where we still need to work on, and that we need industry in order to create more endoscopes with weight reduction, with better accessibility to the control wheels. This is something where industry can really help us and must help us.
Well, that's really useful information, so thank you very much, Dr. Nagl. It's been an honour to have you here, and we hope to catch up with you soon.
Thank you.
Thank you.